Cardiac rehab is what we call a secondary prevention program, meaning we want to help patients prevent future heart-related events. A large focus of what we do is on recovery from the heart event using exercise as a modality to help them get better. But we also focus on things like their risk factors for heart disease. So we'll talk a lot about dietary habits. We'll talk about cholesterol management, blood pressure management, diabetes management, because those are really the things that will help someone prevent a future heart problem down the road.
Patients get a lot of benefit when they participate in cardiac rehab. I think the most important one is that they can actually feel comfortable getting active again. As you can imagine, after their heart undergoes surgery or after, say, a heart attack, most patients are very reluctant and they're actually scared to get back to being physically active. And so this allows them to do so and have nurses available to answer questions or to reassure them that, hey, things are going well, looking good.
When a patient comes to cardiac rehab, they'll initially start with a one-on-one session with one of our staff where we sit down, we do some intake questionnaires and kind of assess how you're doing since your hospitalization, and then we have them do a little bit of exercise to make sure things are looking okay right off the bat. After that, a patient will come to one of our group exercise classes. We'll get their weight and make sure that their vitals look okay, such as their blood pressure, heart rate, and heart rhythm. Then we'll do a group exercise stretch to make sure everybody's warmed up for exercise. After that, people will go to their respective pieces of equipment. So that might be something like a new step, which is a seated stepper that is a good form of cardiovascular exercise, or a treadmill, or we'll do a stationary bike. Usually people are on one of those pieces of equipment or a combination of them for 20 or 30 minutes. After that, we'll do group weight training where everyone does their own individual free weights, and then we'll do some group stretches and get some final vitals when they're done.
They very much enjoy the group atmosphere, making friends, getting to know the nurses and the other patients. Allows them to see that other people are going through similar things that they've gone through. And then a lot of them say that they've learned a lot.
It's been excellent. You come in with a lot of worries and concerns about my health down the road, but their experience, they know what they're doing. They have a lot of respect for you. They treat you like an individual. I'm really impressed with the quality of the people here.
Probably one of the most common misconceptions is it's going to be harder than they want it to be. We generally don't have the no pain, no gain mentality. We like to really meet people where they're at when they get to us.
The staff was absolutely wonderful about relating to each and every patient in here and checking on each and every patient, no matter what your physicality was, and making sure that everybody was doing okay, because sometimes people are a little apprehensive about saying, I'm not feeling so great. They would ask us at least 3 to 4 times throughout our hour what level we were at with intensity, with any pain, with how we're feeling. So we had to constantly tell them how we were feeling as we were progressing throughout the hour.
Usually people work with us for anywhere between 8 to 12 weeks, depending on their progress and goals, and then at that time they're discharged to more of an independent exercise program.
One thing that we often bring up to them is the fact that there's been multiple studies that have shown that patients who participate in cardiac rehab do way better, have way better outcomes than patients that don't participate in cardiac rehab.
Cardiac rehab has also been shown to lower the risk of getting readmitted to the hospital and can help someone deal with depression and anxiety that they might have after a heart-related event.
I feel pretty good. I'm winding up my stay here, but I think I have the equipment to help me down the road to lead a good life.
It was such an encouraging program from beginning to end, and I would recommend it to anybody, no matter what duration, post-surgery, to come and give it a try for sure.